Okay, I'm back. So, for those of you with the wall, you're just going to put your hands against it. Your back leg is the one we're stretching. We're going to try to get more dorsiflexion, or the ability to bring our toes up towards our shin. Okay, we're shooting for more dorsiflexion by stretching out our calf muscle, our gastrocnemius, and our soleus muscle gets a little bit more stretch with a bent knee. So if you don't find a lot of stretch here, maybe bending your knee will get you a little bit more. We need all of this dorsiflexion in our ankle to help with running and jumping and propelling and actually accepting load and squatting. I had people do a 10-minute squat test 2 weeks ago. I got a lot of comments about that people really struggled with it, that they really had a difficult time staying down in that position, mostly because they felt like they had to bend over a lot. And if we're lacking ankle dorsiflexion, what I have in my back foot right now, it's really going to force your weight forward because your butt's going to want to fall back. So to stay balanced, we flex over. So that just goes to show how our ankle can contribute to stuff going on at the back, the hips, and the knees. So we're going to switch legs here, and just going to be here for a minute. I'm going to try to keep it to a minute. Yeah, so if we're lacking this, we're really going to start putting a lot of force forward in our body. And so what I mean by that is as we land and try to propel, instead of the ground reaction force going behind my leg, so my soleus and my glute can propel me forward, it goes in front, which puts a lot of stress through my patellar and quad tendons because I'm starting to use my quads a little bit more to go forward. That's actually not what our quads are supposed to do as we run. Our quads are actually accessory to running and jumping, where it's more of our glutes and our soleus muscles in our lower leg that help us do that. We got about 10 seconds left. Then we're going to do some foot exercises to get those toes and bottom of the feet working, because if we don't have a good base of support on the ground, you're not going to have a very good base to move off of. So we want to make sure that we have strong, mobile, and controlled feet. Okay, so we've done our calf stretch. We're going to use all this stuff in a little bit. Hopefully my pattern is coming very apparent. We stretch, we mobilize, we use, that kind of thing. And so we're going to be putting our feet into plantar flexion, which is toes pointed, and we're going to go into dorsiflexion, okay? You're more than welcome to lay on your back for this. And if you can't do what I'm about to ask you to do, all I want you to do are ankle pumps and ankle circles. So you're just moving your foot up and down and in circles, if you can't do this next move. So what you're going to do is you're going to lay on your back. You're going to hug behind your knee. Everything's passive from the knee up. But you're going to point your toes. You're pointing your foot, excuse me. And then you're going to curl your toes under. And then you're going to keep your foot pointed, but bring your toes up. And then curl and extend. You'll see I'm just moving my toes. We're going to do 5 of these. I think I'm at 3. Maybe your feet are cramping, and that's telling you, hey, maybe they don't get this input very often. Maybe you don't just use your toes very much. Good. Now we're going to go into dorsiflexion. We're going to do the same exact move. We're going to flex our toes and extend our toes. And flex our toes and extend, all while keeping dorsiflexion in your ankle. So really playing mind games here. Some of you might not be able to do this. Like I said, if you can't, just make those ankle circles. And 5. Good. So we're working on the foot intrinsics, the muscles in our feet that help give us arches. We actually have 3 arches. We've got, front, back, and then a side, front, side to side, and then another one that kind of goes at an angle. And so we're working all those muscles in our feet. Let's go, we're switching sides. You're hugging, and if you can't do this, you're just doing the ankle circles and pumps. You're going to point your foot. You're going to curl your toes, extend your toes. And yesterday when I was practicing this, I noticed I struggled on this foot a little bit. So hopefully it's a little better today for you guys. And we're going to go one more. Flex. Oh, feel it, maybe a cramp, and extend. Relax, maybe shake it out. And now we're going into dorsiflexion while we do it. So toes back towards your head. You're gonna flex and extend. Flex and extend. The movement's only in your toes. I'm gonna do a couple more on this side because it feels pretty good today. All right, okay. So we're waking up our feet, waking up our ankles, and now we're gonna use them by doing some toe walking. So we're gonna actually be getting toe extension, but ankle plantar flexion, okay? So we're gonna have our toes folded back, working on that mobility of those toes, especially the big toes that we need. You're just gonna be walking, and we're just walking nice and slow, and this might show you that maybe you need to work on your balance a little bit. Because if you're really walking fast, that means you don't have lots of control with this. So we're getting into some extension. We're reinforcing some of the toe extension that we were working on a second ago. Calf strength, soleus strength, glute strength, all this stuff. If you have maybe an Achilles tendinopathy, some pain in the back of your ankle, this is a good little isometric to do, working on the strength of your calf but not going through range of motion that might tick off your Achilles. And then we're going to go down onto your heels. Now this one gets a little weird and clunky, but we're working on the front of your shins. If you're recovering from shin splints and you're starting to work on your endurance again of your anterior tibialis, maybe you're getting better dorsiflexion in your ankles, working on this endurance is going to help maintain those gains. Maybe you do your calf stretch and you start walking around on your heels to reinforce that dorsiflexion. And so I'm just kind of clobbering around. You can have shoes on, that's cool. I love being barefoot. I'm pretty much barefoot from May to November. If I'm outside, I'll have some shoes on, but they're probably flip-flops. And then in the winter, if I'm at work, I'm probably in socks. All right, and maybe one more lap. I don't know. Trying to take our time with it, working on the endurance at the front of the shins. Okay, so once again, we're trying to reinforce that better ankle mobility so we can have better biomechanics in our knees and in our hips for when we go to do more athletic movements. All right, so I asked if you had yoga blocks to run and grab them. You don't need the yoga blocks, and you'll see why. It can be anything that you can stand up, just like that. So we're just putting these guys here. Actually, I'll move back a little bit. And so we're kind of starting to get more into the hips here. We're going to still focus on ankle dorsiflexion, but we're going to be flexing our hips as well. And if you've been following along, we're in week 4 here. If you've been following along, you know that if we're using our hip flexors, probably the next thing we do is a variation of a hip flexor stretch, and you'd be correct here. But for now, you're tall sitting, you're long sitting, and upright. And from here, I want you to create lots of tension in your belly. You're going to lift up and over, and then back. But you have to make sure you're not rocking forwards and back. Let's see, maybe from the side will be a bit better. And if upright yoga blocks is too high, put them down. And if that's too high, lay them real flat, okay? So from here, I'm nice and tall, strong in my belly, and we're going to do 5 on each side. So I'm going to do 5 just on the right, and then I'm going to go ahead and do 5 on the left. So I'm tall, and once again, this could be anything, just something you're not going to break. So you're nice and tall, brace through your trunk. 1, 1, 2, 2, 3, stay tall, 3, 4, 4, 5, and 5. Okay, so my right one, pretty good. I had to dump into my low back just a little bit, so it tells me, okay, I could probably be a little bit stronger in my trunk, and I know that that's an area of weakness for me. So here we go. 1, 1, 2, 2. I'm maintaining that ankle dorsiflexion. 3, 4, 4, 5, 5, and 5. Okay, so we've warmed up our trunk a little bit. We've started using our hip flexors, telling them when to turn on and turn off, versus sitting all day where we're just telling them to be short. We're not giving them any signal when to be on, when to be off. And so what they're likely going to do is just start to shrink up, and shrink up, because our muscles have an elastic quality to them. And if you put them in a shortened position, they're going to shrink up, then they're going to want to stay there because that's kind of their new baseline. Then you go to stand up and they yank on your back or they yank in the front of your hip. It doesn't feel very good. So here we're just giving them a signal of when to turn on and when to turn off. And so as I said, we're going to follow this up with a hip flexor stretch of some sort, and today it's going to actually be the bretzel. And so we're going to do a bretzel that's going to stretch out our thoracic spine, our pec, our quads, our hip flexors, and our glutes. And then we're going to do another hip flexion exercise, and then we're going to do some more mobility stuff. And we're actually going to circle back to another hip flexor stretch here in a minute. But to do a bretzel, you're going to lay on your side. And for me, it's my right side. And I'm going to take my top leg, and I'm going to hold it from underneath with my bottom arm. You can hold it on top here, but it might be hard to rotate your shoulders back here in a second. But I'm going to hold underneath. I'm going to pull my knee up towards my chest. And then with my top hand, I'm going to reach back, grab my ankle, and pull back. So I'm getting a great quad stretch already. I'm going to relax my upper body and try to roll back. And breathe out. And you're getting a good stretch in your quad, maybe in your top hip, maybe in your top pec or chest. And you're just breathing more and more, trying to roll back more and more. And we'll be here about a minute. I can't see my watch, so I'm going to have to estimate. And then we're going to roll over and do the other side. Then we're going to use our hip flexors even more. This next one can cause lots of cramping. It's pretty difficult, but it's going to help gain range of motion in your hamstrings, in your glutes, and in your calves. All right, so you're going to ease onto this one. And we're going to switch sides. And if for some reason, maybe this is bothering your back, you can just pop your knee down to a hip flexor stretch. We're going to get around to that in a minute here. That's going to be the stretch we get to for your hip flexors in a minute. It doesn't hurt to do it twice. Once again, bottom hand underneath the top leg, top hand reaching for your bottom ankle and pulling back. Getting a nice quad and hip flexor stretch, then we're rolling back. And just breathing deep, getting nice hip flexor, quad, glute, pec, thoracic spine stretch. We're really stretching a movement, not necessarily individual muscles. This is going to help us rotate, flex, and extend our spines, extend our hips, even flex our hips because we're stretching out our glutes. So we're doing a lot here in just 1 minute. And breathing, breathing, breathing. If you find that you are stress breathing, maybe you're holding your breath, maybe you're taking maybe you're taking shallow breaths, you're definitely pulling a little bit too hard, maybe back off your stretch. And that goes for all stretches. If you can't gently and calmly breathe during your stretches, you are going way too hard. Okay, you need to back off. Stretching is something that needs to be relaxed through, not forced upon you. Your nervous system is never going to let you gain range of motion. It's not going to happen. So we've stretched a lot of stuff out, and now we're going to do we'll call it an active stretch for our hamstrings and our calves, but it's also an active hip flexor strengthening exercise. And you're going to be on your back, and if you struggle with this is going to be your go-to. You're going to hold and kick if you struggle with what we're about to do. And we're going to make 8 reps on each side, and you're going to have this as your starting position. No hands, okay? Hands are on the ground. I'm maintaining hip flexion with my muscles. I'm pulling my ankle back into all that dorsiflexion that we worked on earlier, and I'm kicking straight, or close to straight as we can get it. You want to try to maintain 90 degrees at your hip, even if this is the only place you can get your foot or your knee, okay? We're kicking up 8 times, 2, trying to maintain our hip flexion. 3, 4, 5, driving your heel up towards the ceiling. 6, 2 more. 7, and 8. All right, so I'm gonna switch sides here. See that working leg? You guys can stay where you are. Got my down leg as straight as can be. My working leg is at about 90 degrees at my hip. My hands are off. Unless you can't do this, then you're holding and stretching. The rest of us are kicking straight. Oh, just like the other day. A little bit more tightness in my left leg. 3. It's just a brief pause at the top. 4, 5, 6, 7, 1 more. 8. Okay. Clearly, there's an asymmetry there. Okay, so we've used our hip flexors, we've stretched our hip flexors, we're gonna stretch them again. But right now, we're gonna work on a little bit of hip internal and external rotation. At the very beginning today, I said, if your hips don't rotate, then they aren't hips. And so if your hips don't rotate well, you don't wanna load them up by doing deadlifts and squats because we need hip internal and external rotation for that. You don't wanna produce rotational movements like golf throwing or anything like that. And we wanna focus on reestablishing good amounts of hip internal and external rotation, roughly about 60 degrees on either side. So you're gonna sit nice and tall with your feet out at about shoulder width, hands behind the start, and you're just gonna drop. And you're gonna drop. And those of you who wanna try can sit up tall, take your hands away, and we'll make it a little bit more active. So we have to use our nervous system to control this. And we're starting to imprint hip internal and external rotation into our nervous system and our motor pathways. We got 5, and we're gonna do 10 to each side. 5, and maybe if this is easy for you to maintain an upright posture, maybe you go down and you stretch, no hands. And then you switch. If this is a struggle, then you just stick with the no hands. If that's a struggle, you put your hands on the floor behind you. 2. And you're gonna scoot a little bit on the floor. 2. And 3. Hip internal and external rotation. 3. If you get a pinch in the front of your hips with this, go back to the hands on the floor. 4. 4, we got 1 more to go, then we're doing a hip flexor stretch. Oh, I skipped it. 1 more drill and then a hip flexor stretch. All right. I wrote what we're doing really small on the wall behind the phone, so I'm struggling today to see. Need to get my eyes checked when we get out of quarantine. So we had our hips kind of flexed with those, doing some internal and external rotation, but a lot of times when we go to do movements like a golf swing or throwing, things like that, hip internal and external rotation is done with our hips kind of neutral. So we're not extended and we're not flexed a little bit, or maybe we're flexed a little bit. But we're gonna do 90-90 switches that involves kind of doing a squat, kind of doing a lunge, but definitely rotating our hips from internal to external rotation. So you're gonna start in your half kneeling position, front knee bent to 90 degrees, foot flat, hips at 90 degrees, and here's the kicker, the back toes tucked under, okay? Always working on toe mobility where we can find it, okay? It is crucial to athletics, to movement, to life, trust me, okay? We're gonna be going up, rotating our hips and switching. And now we're down on the other side. Toes, knee, hip, knee, ankle, right? Then we go to the other side, up and down. We're using the range of motion that we've been working on. And we're reinforcing all that mobility and flexibility. You want to make sure that your torso is upright, you're not leaning back. I think this is 3 on each side. We got 2 more to go. 4. 4. We're also working a lot on balance here because your head is moving, your eyes are moving. So we're testing out your vestibular system for your inner ear, your visual system, and then your proprioceptive systems with your feet moving. So it's a great balance exercise too. And now, as promised, for a long time, another regular hip flexor stretch. So I've got my mat here. If you need to, grab a pillow to go underneath your knee. But you're going to be back into half kneeling position. You're going to lean forward, tuck your butt, and come on up nice and tall. Stretching out the front of your hip. And we're going to be here 60 seconds. If this is easy, grab the ankle, come back up, but don't lean back, okay? We don't want to compress the low back. We're just pulling, pulling, pulling. Stretching out your quad. If your knees are bothering you, I would suggest just staying here to distribute the force through your knee a little bit better than this and crushing your kneecap into your leg, which can be a little bit uncomfortable for people. Ooh. And we got about 20 seconds left. Just breathing once again. Breathing is something you should, or stretching is something you should want to do again. You should be able to comfortably breathe. Use it as a moment to relax. All right, so we're going to switch sides. We're going to go through this last hip flexor stretch of the day. We got all our 90s set up. You're going to tuck your butt under. Grab that ankle if you can. If not, just leave that foot down on the floor, stretching out the front of your hip. Working on improving our hip extension. Very few things get worse as you get better hip extension, I promise, okay? Our athletics become more powerful, our movements through every day get more efficient. We're able to just move around and interact with our world a little bit easier by gaining hip extension. Also, it takes some of the pressure off our back, creates less of a pinch or FAI, an impingement, femoral acetabular impingement in the front of our hip if we can keep it nice and loose, and improve the way our pelvis and our femur interact with each other, move around each other. All this stuff just from a simple stretch. It's unbelievable. Then you got to reinforce it with something though. And that is about to come. So we're going to do a hip extension exercise. Some of you may have never seen. Some of you may have and have maybe been too scared to try it out. But those of you who can't do it, maybe you do get that pinch in your hip. Maybe you get that FAI I was just talking about. Or maybe your knees are a little bit tender and they don't like being in full knee flexion. If that's the case, your default right here is bird dogs, okay? So you're gonna be doing bird dogs. If your hips hurt when they get pinched down, or if your knees hurt by getting fully flexed, then your default right now is the bird dog. But this is called a low kneeling bird dog. That's the exercise we're going after. And so we're passively trying to put your pelvis in a very stable position and then only allowing or only providing the movement through your glute. And what I mean by that is we're going to put your leg in a position where the only thing that can move your leg is your glute. So if you can't move your leg, your glute either isn't strong enough or your hip flexors are too tight. Okay? It's one or the other. That's all it is. So this can be very telling as to what you need to work on. But what you're going to do is you're going to be down here with one leg extended back. And so it looks like this on this side. Okay? So I'm really flexed in my hip and really flexed in my knee. And so we're going to be moving the back leg. Now the only thing that can help that extend is your glute. So you're down low on your forearms and you're just lifting. And you see how little movement I actually get. And I have very flexible hips and very strong glutes. And I can still only get a little bit of movement. And we're going to go for 8 on each side. I'm going to count that as my 1 already. 2, and I'm trying to get my knee off the ground. 3, 4, 5, 6, 7, and 8. Okay, now I'm going to switch sides. We'll see how this leg does. My hip's a little bit weaker on this side, but I've got that extension being forced in my hip. Okay, here we go. 8 more on this side. 1, 2, 3, 4, 5, 6, 7, 8. Whew, okay, so that was a little bit more of a struggle on that side actually. I felt my adductors kicking in. These guys that can kind of help with hip extension if our hip extensors aren't strong enough. So my glute was only able to do so much that my body started trying to recruit other stuff. And so I felt that actually in my adductors a little bit. So it's like, okay, I fall into a pattern. I know that my glute, my right glute, is weaker than my left. That's not a surprise why my body was trying to recruit other stuff. But remember, if that's too hard, just bring it back up, do your bird dogs, work on your hip flexibility and your glute strength somewhere else. Don't make that the #1 priority to say, oh, I need to do this exercise to make my glutes stronger. No, you want it to reinforce just training your body for hip extension through your glutes. All right, where are we? Okay, beautiful. We're gonna work on rolling. Last week for the neck and shoulder, we went over some rolling patterns or patterning with our arms, but we can do the same thing with our legs. And it tends to be a little bit easier with our legs because we got a little bit more mass in our lower body than we do in our upper body. So we're gonna work on flexing our hip, using our oblique sling or our oblique muscles to help go from on our back to on our stomach. And then we're gonna use our glutes to help bring us from our stomach onto our back. And if you lack hip extension or if you have poor thoracic or mid-back mobility, this is gonna be a struggle. But this can be one of those drills that you practice that makes that low kneeling bird dog better, or once you stretch out your hip flexors can help repattern hip extension back into your hip, allowing for better movement and more powerful movement. So you're gonna be laying down on your back, and I'm gonna show you one. Maybe just watch me do one complete rep. We're only gonna do 3 on each side, but watch me do one complete rep before you join in. So I'm gonna do one example, and then I'm gonna do 3 more with you. So you're on your back. Actually, I'll scoot up this way. Your arms are overhead. I'm gonna bring my right leg up, over across my body, and everything else is gonna segmentally follow. I'm not using my arms to push, and now I'm on my stomach. Now I'm gonna use that same right leg, I'm gonna lift up and over with just my hip and my leg. I'm gonna leave my hand and head out of it to segmentally roll back onto my back. And so if you have a difficult time rotating in your thoracic spine, you're gonna get stuck and you're gonna move as one big piece. It's called a log roll. We're going for segmental rolling, not log rolling. But this could be a good drill to help that. And so we're gonna go 3 more on each side. So arms are up and over, up and over, and there's 1 rep. Not pushing with your hands, everything is being initiated with your leg, and everything follows. 3, and 3. If you're just tuning in and you're seeing me flop around on the ground, we're going over rolling patterns, which are gonna help to reinforce hip extension and flexion and coordination between our hips and our obliques. We're going on the other side now just for 3. Up, over, no pushing, no arms, no head, no opposite leg either, okay? It's only 1 leg. And we got 1. Up and over, everything stays behind. 2. And 3. So, I have seen probably hundreds of people try those over the years. And I'd say it's about 50-50 for the amount of people who can do them or not. And it usually comes down to not being able to get into the hip extension and not being able to have the mobility in their thoracic spine to allow them to roll properly. So once again, if you found that you were limited there, stretching your hip flexors, using your glute, and mobilizing your thoracic spine are going to allow you to repattern rolling, which, as you saw, is just a rotational movement. So if you do sports like, golf, throwing a ball of any sort, could be baseball, softball, quarterback, water polo, that kind of stuff, you're going to want to make sure that you can maintain your ability to roll with your upper body and roll with your lower body. So we're going to start piecing some of this stuff together with a Cossack squat. So we're going to be working on going laterally because we do so much in a forward fashion when we're exercising. All the kettlebell swings, the lunges, squatting, deadlifts, pressing, pulling, all that stuff is in this what we call a sagittal plane. But very rarely do we go in this frontal plane of side to side. Mr. Roboto. It's Friday. So we're going to be standing. You're going to take a nice wide stance, but you're going to keep your feet facing forward, okay? If for some reason this bothers your knees or your hips, then you can turn your feet out. But for right now, I want you to have your feet facing forward. And you're going to imagine that you have a little stool behind your right leg and one behind your left, and you're trying to sit back onto it. And we're not just going to go from side to side to side to side. We're going to take a little pause at each stool. And we're going to make 5 to each side. It's going to be 10 total. So I'm going to be going to my right first. You can go whatever direction you want. But this is going to stretch out our adductors, those things that were kind of biting me before with the low kneeling bird dog or hip extension. So we're going to be stretching our inner thighs. We're going to be stretching out our butts. We're going to be loading our lateral hip, which we need tons of strength for when we run, because every single step we take is basically accepting weight or our body weight on one leg, so we need to be able to prevent ourselves from falling over. So we need lateral hip strength, and we're strengthening our glutes. Yay. So we got our little stools behind our feet, and you're sitting back, and your chest stays up, and you're paused. And then you come back up to the middle, and you go to the other side, and oh, do I feel a stretch on that left side? Or right side, excuse me. It's Friday. There's one. We got 4 more to go to each side. Sitting back, tall chest, knee is in line with your foot. Okay, you're not letting yourself go here, and you're not going way out to the side. You're just staying in line. And we're going for 2. Up. Snap, loading up that lateral hip on the right or left or whatever side you're doing. And we got 3, nice tall chest. And we're on to 4 already. You guys have probably already worked out today, exhausted your legs, and I'm making you do more. It's unbelievable. I can't believe you guys have been doing this today. And we got our last one coming here. These are like half Cossack squats. So this is number 5 here, and you guys take a break. Good. A full Cossack is down here, where you're going all the way down. That's not for us. All we need to do is load up those hips, get about halfway down, pretend we're sitting on those stools. We have 1 exercise left, and it's a forward and backwards heel and toe tap. This is going to load up our patellar tendons. Maybe we've been having some anterior knee pain, some front knee pain. A lot of that can be from having limited ankle mobility. We talked about that a couple weeks ago. But if your ankles are limited in dorsiflexion, that stress gets put into your patellar tendon, gets pissed off. To remodel that tissue, to help it heal properly, we actually need to load it. But we need to have slow and controlled reps. And we need to do some isometrics, which are things like squat holds, little one-legged holds, and various other things that are way too in-depth to go into today, but at some point we'll get in there. And so, very simply, you don't need anything for this, but you can use a block or a step, maybe one of those aerobic steps, something like that, and I'll show you a variation here in a minute. But all you're doing, I'm going to work my left leg first. Let's see here. All right, this should be good. So I'm standing with my left. I'm gonna tap my heel out in front. And you'll see my thighs are pretty parallel, okay? And you come up, and then you tap your toes and back. And you're up, and you tap, and my chest is up. And I'm really working on my balance, my glute, my quads, my patellar tendon. I'm not flying through this. This is about the pace I want you to go. If you need something to hold on to, take it. It's not a balance exercise. It's cool if you want to work on your balance while you do it. It's not necessary. Now I'm going to do one more on this side. Then I'm going to grab a little block or a step and show you a progression. 5. So I feel my quad. I feel my IT band area, which is really just over the top of my quad and my hamstring. And then my glute working really hard. That's all good stuff. And so now if I want to progress it, I have to go a little bit deeper. What do? I find a block. This might be a little bit soft for me. I'll probably fall off it because I'm on my right side. I'm tapping forward and going back. It's a little soft for me. Typically I use a wood block. All right, let's see if this will do. Okay. All right. Lose my head, oh no. Tap, touch. And these are basically just like single leg squats. But we're stressing your patellar tendon in 2 different ways. Here, there's a lot of stress. My knee is going past my toe. Despite what you've been told, that's okay. We do it all the time. It's normal. It's natural. We need to actually possess the ability to do that to make good squats. I think this is 4. And we got one more left.